Hello, it's Kim here with the Good Herbwife podcast, and I'm hoping the cat's going to behave, but he's decided to join me. It's a beautiful winter's day, but it's very cold outside, and he's decided he wants to come in. And today I thought we'd take a stroll through some top tips from myself and the box of wisdom from Dr. Kevin Baker about what good health is about. How can we attend to our health? So even if we've got chronic health problems, we can do lots of things to take care of ourselves. Because I think modern medicine, wonderful although it is, with something like the notion of the NHS, we've got ourselves in a bit of a muddle where I think that people have got into the habit that just taking medications that's going to just deal with some symptoms of disease or suppress a disease. But there's more, there really is more to life than, managing disease management processes. What about enhancing what we have? So we've got a healthy body, let's maintain that and keep that going. Or if we do have chronic health problems, what can we do there, to either ameliorate what's going on, improve what's going on, or, indeed, I use that in quote marks, cure. So maybe having a cat might help, it might not at this point. So I'm just going to get my glasses on and read some of the words of wisdom. I'll do a close-up picture of these in a moment. So these were Kevin's notes about advice to preserve health. So number 1, drink good quality water. Reduce one's chemical and environmental exposure, pollutant exposures. Eat only organic food and avoid processed food, he says. Take regular exercise. Have good sleep. Good dental care. Brush your teeth twice a day. Find your passion. Seek beauty, harmony, and again, sort of get enough sleep and rest. Cultivate relationships, friends, family, and community, and do your soul work. And under that, he's got heal the wounds, find meaning and purpose, and open up to the bigger picture. So let's put the cat down. Thank you, cat. He's probably going to jump up again in a minute, but that's what cats do. So yeah, good quality water. I said before, I think that we're up to 70 to 85% of our body is fluid, water. All the cellular interactions are done through that medium. So keeping everything flushed and filtrated and hydrated is really essential. So, water or eating fruit and vegetable will give you that hydration. In terms of chemical exposure and environmental pollutions, I think we're kind of aware that we've got quite a heavy load going on in modern life. So that's, you can do things like, keep your house well ventilated, for example, or don't have lots of household cleaning sprays. They're really very bad, especially if they're the droplet ones. In fact, the patient of mine was recounting recently how her oncologist was saying one of the most important things is to not have lots of those cleaning products in your house, as he considered they were a great carcinogenic processes set up with that. Kevin's put down only eat organic food. Well, I think that's fine if you've got the pocket for it. I question that myself. I'm a bit more of a pragmatic lady. I'd say, eat as much local food, fresh food, grow the food you sell yourself if you can. A little bit in the garden, or if you want to get into allotment growing, absolutely fantastic thing to do. And absolutely avoid processed food. There's a lovely book. I'll see if I can remember the link and put it in the bottom. I think it's by Michael Pollen, and it's just these really simple food rules, and they very much follow what I advocate to my patients about eating food as close as it's come out of nature from, and that if it's food that your grandmother wouldn't recognise, then maybe steer clear of it. And also, I say to people, read the label. If it's got like more than 5 ingredients, and if there's names of things that you don't even understand, recognise them as food stuff, then I would suggest it's probably not the best thing for your body. And I'm just reminded of my husband's, that sense of, he was a man of great service, and even in his days of great ill health, and he was actually in Brighton Hospital, in the hospital bed, and there was a fellow patient next door to him who'd been in hospital, I think, for nearly 18 months with ulcerative colitis and huge digestive problems, and he kept getting fissures, and Kevin just sort of leant over. He was terribly ill himself, and just started to chat to this man, and got him to look at different foodstuffs, and it was a real boon, because it really turned that man's life around. So I hope he's out there still going strong. Um, what else have we've got? We've got the good sleep. Absolutely, I would say that is really important. For example, if I'm treating someone with high blood pressure, I will always actually attend very much to see what their quality of sleep is like, and if they're getting enough, and lots of other health problems. But if we're not able to go into that relaxation state, and our body's not using its innate healing powers. So really important that sleep is deep enough and long enough. And dental work, teeth, absolutely keep your teeth clean. If there's dental problems, sort them, because we have good bacteria and bad bacteria in our mouth, and there's studies coming out now with the correlation that if you've got compromised oral health, and you've got a lot of bacteria, bad bacteria draining down into your gut, there's a correlation, for example, to quite a few bowel cancers. It's interesting research going on there around that. So what else? We've got take regular exercise. Well, I think we can all, whatever is appropriate to you, get out in the world, have fresh air, move, move about. It's like the mere act of walking will actually massage our bowels. So say, you're someone who's got sluggish bowels. If you're walking, that's really going to help the innate processes of the body. Find your passion and follow it, and seeking beauty and harmony and having gratitude. These are all states of being which are a really good thing to cultivate, because otherwise we're in a conflictual state with ourselves. There's internal conflictual states, or sitting in judgment on others and the they and the them in the world. We do not need to be people of politics, for example, all the time, or action or campaigning. We need things that bring out our beauty and our creativity, and we all have our own individual skills and talents for that. For some people it will be gardening, other people will be crocheting, and other people great paintings or writing novels. All these things feed us in our different ways. Cultivate your relationships. They all take care and attention and time, and they're worthwhile. So we're connected. We're social animals. We need to be connected. And when he says do your soul work, I mean, Kevin did a lot of psychotherapeutic work, and I guess I, as a healer, I'm, often sitting in that place with people, looking at the what ails ye, what ails thee, what troubles us. Often people say I'm fine, and you go, well, what really is going on? And then the story will come out. So in terms of, healing the wounds, attend to your griefs. Actually, sometimes you just need to name the things that are a problem, but bring again that attention of harmony to it. Drop the blaming and do your inner work, and find meaning and purpose, and open to the bigger picture. So that, for some people, they may put that in a very religious or spiritual context, but I would say, we can all be humble in the face of being on the earth and in nature, and to know there's a much bigger story. In our family, we say, look, we're a teeny tiny dot in a huge cosmos. So I think it's reassuring. For example, when we stand on the earth, I live on the chalk, and I'm going to go out in the brilliant winter sunshine in a minute and go for a walk. But when I'm standing on the chalk and thinking of the hundreds of millions of years of sea life, all the little shells that made up the chalk that I now stand on, the seas moved, the land's moved, the wind and the rain have shaped the downland hills around me, and all that layering of life. And here I am, right here now in, what is it for me, 2021, just a little speck in that story. That great wheel of life, will turn on and round, and that is all quite appropriate. So that is really a very quick sweep through the great themes of what we're looking at as practitioners. If we're working holistically with someone, we're not just going, you've got a pain here, let's attend to that, let's check in on all these other levels. And this can take, quite a bit of time to work this out, but I'm sure by listening to this, light bulbs might be going in your head. You're going, actually, I need to attend to that. Or even it might be something I've said and it's really irritated you. And that could be the very thing probably you need to attend to. So anyway, thanks for listening. It's just a little quick whiz through those areas. And as ever, I'll try and do some more. Don't see why not. It's winter time. I'm not busy out in the garden. So look after your well-being and see you again soon.